violations and to recommend measures to protect and enforce the rights of children, including legislative outcomes and policy reform. Part of our work on vulnerable child populations have brought us in contact with children who have been adversely impacted by internal displacement and conflict. Recently, we visited relief camps for displaced persons in Assam and in Tripura as well. In Assam, we visited the Chirang and Bongaigaon districts, and in Tripura, we went to Ashapura, Naisinpur, and Hamsapur. It would be an understatement to say that we were appalled by the subhuman conditions under which those people lived. A fact which was highlighted by the testimonials that they gave us when they speak about the enormous tragedies and suffering that they undertake on a daily basis. What struck us was the basic lack of integrated services and support for these children and their families. In particular, the critical lack of health facilities, sanitation and educational facilities. A new generation has taken birth in these camps, but it's as if they don't exist. There is no or very marginal registration of birth and deaths. There is hardly any immunization, no health facilities or primary health centers, no functional schools, no safe drinking water, and very poor sanitation and inadequate rations. Death and disease stalk these children every day. It is this daily lived experience and encampment which defines these children's sense of identity, belonging and well-being. To cite the odds against which these people live and to humanize what these children go through, I thought I should share with you one or two stories that we came across during these testimonies. We met a father whose abject poverty and despair has driven him to leave his 4-year-old daughter in his tent to die of blood dysentery because he doesn't have access to medical facilities and doesn't have the money to take her to a private doctor. We met a young woman in the Ashapara camp whose husband and 2 children passed away from malnutrition and blood dysentery. She's left with a 4-year-old child who looks like a 2-year-old from severe malnutrition. She herself is pregnant. And the funny thing is that when her 2 children and husband passed away, the government was very quick to strike their names off the list. They have these lists on the basis of which they issue rations. But they failed to include her surviving child. So on her limited rations, she, her mother, her sister's family, this child and herself live, if you can call that living. So in other words, they're basically starving. What really surprises me is that these are not, they're called displaced, temporarily displaced people, but in our view, they're permanently displaced because they've been here for like close to 10 years and they're not even being given basic amenities. These are just some of the stories that surfaced. The need to address this emergency situation and to ensure fundamental human rights of these people and children includes access to all their entitlements as citizens of this country. The starting point of any discussion on the rights of children, displaced or otherwise, is that children are entitled to and should be given all the rights that a citizen enjoys, irrespective of their status, their caste, their creed, their religion, or the region that they belong to. The reason why I say this is that in our interaction with the state government, whether it was Assam or it was Tripura, and we've done a lot of work in Chhattisgarh as well, which I'll talk about just now, the argument that we're always given is it's political actually. It's that they don't belong to our state. And if we give them the facilities that you're talking about, they will settle here permanently. And our counter to that is that as far as we're concerned, it shouldn't matter to you whether they belong to Tripura or they belong to Assam or Mizoram. They're children and they belong to India and they should be given food, shelter, clothing, education. We need to look at things in the present in the sense that these children are actually in a permanently displaced situation. As mentioned earlier, these children have taken birth in these camps and they know no other existence apart from what they're exposed to in these camps. So what happens to these children? What impact does it have on their present? And do they have any future? The concern of the Commission in the present is that this temporariness that we keep talking about, there's a permanence that is linked to it, and that is the excuse that is being used to deny them their basic rights. The rights of children, as we all know, is protected under UNCRC and the Constitution of India and various other legislations. And the state and policy makers need to urgently recognize the despair and struggle with which these children and people live. As included in my introduction, we've looked at children in this last 18 months as a whole. And we have intervened in the case of tribal children affected by conflict in the Chhattisgarh area, Dantewada and Khammam. I'm not so sure how familiar you are with that aspect, but we've achieved some degree of success in bringing the two state governments together in addressing educational and nutritional issues as far as these children are concerned. And they're actually sitting down at the table now and discussing modalities and action plans on the basis of which they can bring some relief to displaced children. I'm not going to go into too much detail because in Assam and Tripura, I must be honest with you, we've just about started looking at the problem. So we're still familiarizing ourselves with the huge issues and problems that are faced by people in these camps. We've already started interacting with the Home Ministry here because relief and rehabilitation is actually it's on the agenda of the Home Ministry. They distribute the funds and the rations. And we've also interacted with the state governments, indicating to them what we think they need to do to provide basics to these people. So, and we do intend to go back in 3 months' time to see what kind of progress is made. In conclusion, I think it's important for me to emphasize that as far as the rights of children are concerned, they should be given to them because they are children, not because they belong to a particular area or they are planning to send them back to a particular area. And I think it's important for us as fellow human beings to ensure that they get it. And I do wish to assure you that the Commission is committed to that, and we are always open to receive complaints. In fact, our going to Tripura was based on a complaint that we received from this organization, wherein they had indicated some 7,000 odd children were being excluded from the ration list, and were being denied rations. So, thank you very much.